Welcome to The Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome back to The Hair Loss Show, episode number 85. I'm Dr. Vikram Jayaprakash.
I'm Dr. Russell Knudsen.
All right, and so today we're going to cover another topic that we get emails on and messages regarding the use of finasteride, but a side effect from that, which is, oh doc, I've taken some finasteride and I've got gynecomastia, or more specifically, I've got issues with my breast, they've enlarged, or I've got getting tingling sensation.
Or tenderness.
Yes, or tenderness.
Okay, so gynecomastia means enlargement of the breast tissue. And this is a very uncommon but reported side effect from using finasteride and dutasteride. And the reason is this, that basically if you remember how it works, that we've got testosterone, our principal male sex hormone. There is a specific enzyme called 5-alpha reductase, 5-AR, that converts that to dihydrotestosterone, DHT, in this direction. And we're trying to block some of that using finasteride, okay? So finasteride blocks some of the 5-alpha reductase. So what happens when you do this, just to remind you, is that the DHT level goes down and the T level goes up because of that, because it's not being converted. So what happens when the testosterone level goes up is sometimes it goes in the opposite direction over here to estrogen, which we'll just call, I'll just write it here as estrogen, which is a female hormone. And as a female hormone has the potential to cause enlarged breasts. So basically there's a different pathway here called the aromatase pathway. That's the enzyme that takes it in this direction. So for some people, when their testosterone level goes up, there's more of it is converted to the estrogen and the estrogen level goes up. This happens quite commonly to athletes or bodybuilders who use testosterone supplementation. So it's a well understood phenomenon that if you increase testosterone levels,
because you're having more here, and it's if you don't not blocking anything,
you can either get bald or you can get breast enlargement at the same time. So yes, it's not an imaginary side effect; it's a potential side effect. There's a couple of things that I'd like to say about it. That basically 1% of the male population gets it just because they do. Right? For want of a better word, they've got a twitchy aromatase or
there's a genetic propensity that
that's
people
right.
have.
They inherit the ability to have a bit of gynecomastia even with normal testosterone levels. So those patients, even though they may not really be showing much in the way of symptoms, might have an aggravation of their symptoms by using finasteride, because the blood level of testosterone goes up around about 13% using finasteride, and that might be enough to get enough converted this way to estrogen to get gynecomastia. For patients that have clinically shown this to be true to me over the years, if we stop the finasteride supplementation, it does reverse. But it takes months. It takes months to reverse. But I can assure you that we've been able to get the patients to reduce their gynecomastia by stopping the finasteride. Now, sometimes you can reintroduce the finasteride at a lower dose without provoking it, which is another way of looking at whether we do customized dosing. But it certainly does exist, but you probably have to have a tendency for it to exist on finasteride. You have to be a borderline patient for that to happen. And in my experience, again, in my practice in the last 25 years, I've had less than 10 people report that out of thousands of patients that have had thousands and thousands of patients prescribed. We've got less than 10 people that have talked about tingling or enlargement of the breasts, and that we've had to worry about changing the dosing to accommodate.
Yeah, I think there's one aspect is actually having that as an issue, and measurably there's been an increase in breast tissue. Or there's the other that we've talked about, the nocebo effect in the past, where people go, I've taken a tablet and I feel...
my breasts just feel different now.
Different, yes. So I think there's the difference there. But I've got to ask you the question, something that I've got as well, as been asked as well by especially people who are bodybuilders, they should we introduce an aromatase blocker into the mix?
Well, this is where we again come into cost benefit analysis. So if you have enlarged breast tissue using finasteride, the first thing you do is you get an ultrasound examination of your breast. Apart from a clinical examination, you should have an ultrasound examination, because that'll tell you whether it's just swelling or whether there's something growing in there that you need to know about. Breast cancer exists in men.
Yes.
Now, there's no link between using finasteride and breast cancer. There's no link between using finasteride and increasing the risk of breast cancer or aggravating breast cancer, but not all swelling of the breast is the same thing. So the first thing you need is a proper diagnosis. Is this swelling just tissue swelling as a function of estrogen stimulation, or is there something else going on? So do not ignore any changes to your breast. But by the same token, you know, I have patients tell me that, oh, I used finasteride for a week, but my penis and my testicles shrank in that week. Well, I just find it kind of hard to believe that your penis shrunk with a week's use of finasteride. So this is coming back to this nocebo effect. If you believe that you're going to get a side effect, you go, I'm sure my breast wasn't that big last month. So you need to be calm about it, understand that it's very uncommon, but that it does exist. And if you're convinced and someone else is convinced that this is happening, get it checked out, get it properly examined, stop the finasteride until we have a proper diagnosis, and then we'll work out the way forward from there.
The key is to take proper medical advice. I wouldn't necessarily go and sort of self-medicate. You get people who are buying, you know, aromatase inhibitors online and things like that, and I think that's poor practice and poor medicine, because, I mean, estrogen, as you said, is predominantly a female hormone, so it's more important in females. It does lots of things in females. We use estrogen as well in men. So estrogen, we don't want to drive that down to zero. So it's, you know, estrogen has a useful mechanism, and it does a lot of things in men as well. So we want a little bit of estrogen, but certainly too much estrogen can also cause problems as well.
So again, don't take matters into your own hands. Go and seek professional advice, careful advice from someone who knows what they're talking about, and follow that advice. And hopefully we can get around that problem. So I hope that's helped answer that particular question today. It does exist, it just doesn't exist very commonly.
All right, well, thanks very much for watching. Please remember to like and subscribe to the channel. We really enjoy your comments and your feedback. So please do keep that coming, and we'll see you again on the next episode.
Take care.
See ya.